Welcome to Maine Concerns, where our news team gives you a closer look at the events that happened around Maine this week.
Good morning. Thanks for joining us. I'm your host, Cindy Campbell. May is National Stroke Awareness Month, and so I chatted with the nurse program manager for Northern Lights Stroke Care, Angela Wielden. She discusses what a stroke is and what the symptom acronym BFAST stands for. Let's start out with the basic. What is a stroke?
Sure. So a stroke is a blockage to blood flow to the brain. This could be caused by a clot, or it could be caused by bursting of the blood vessels, which we would call a hemorrhagic stroke, or bleeding inside the brain. The most common type of stroke is the type of stroke that is caused by a clot. About 80% of those are those kinds of strokes. So that's what we typically see here at Eastern Maine.
So what kind of risk factors are there? Are some people more at risk than others?
Yes. Yep. There are lots of risk factors for stroke. The number one risk factor is blood pressure, or high blood pressure. And part of the reason why it's such a large risk factor is because a lot of people don't know what their blood pressure is. And so it's sort of silent. If you're walking around with high blood pressure, you might not know it. So we really want folks to know what their numbers are. So that's one example. The other risk factors for stroke are smoking. Smoking causes damage to the insides of the blood vessels. They kind of make them more easily to break. Mm-hmm. So that's one. Diabetes. So diabetes, not having good control of that, type 1 or type 2. Certainly diet, diets high in saturated fat or cholesterol, physical inactivity, obesity. Some of the other ones that might not be as common but are definitely risk factors are something that's called atrial fibrillation, or sometimes you'll hear it called AFib. It's a heart rhythm disorder where a clot can travel to the brain and cause a stroke. So those are just some examples of some risk factors.
Can it be hereditary?
Not usually, no. Okay. There are folks that are at a bit of a higher risk if they have a family member that has had stroke symptoms, had strokes in the past. The ischemic types of strokes are not typically hereditary.
Okay. I would add, you were talking about high blood pressure and being a silent factor. Mm-hmm. As someone who has high blood pressure, and when I tell people that, they say, "You're the calmest person I've ever met. How could you possibly have high blood pressure?" And people with high blood pressure are not running around with red faces and angry all the time. It's really something
That's right.
You can be a very calm, even-keeled person and still be dealing with high blood pressure. So, like you said, worth it to know your numbers.
Absolutely, is knowing your numbers and knowing what they should be, right? So our goal for blood pressure with respect to stroke in particular and cardiovascular disease is really the top number, the systolic blood pressure should be less than 120, and the lower number, or the diastolic, should be less than 80. And so those are the numbers that we are really, really looking at. And so knowing what those are and knowing what your goals are. The same thing for cholesterol levels, too, is making sure that those levels are normal as well.
So regular visits to your primary care physician and getting blood tests is worth it in the end run.
Absolutely.
Yeah.
Yes. Yep.
Can stroke be fatal?
It can be. Yeah. It definitely can be fatal. About 11% of the clot type of strokes are caused by what's called large vessel occlusions, and these are clots in large vessels. So the 4 arteries that come up, 2 in the front and 2 in the back, that give, that's where the blood flow is coming mostly. So if you get a clot in a large vessel down low, that affects that whole side of the brain. And so those folks that come in that have a clot in a large vessel are at very high risk of having a fatal stroke, partly because if your brain isn't getting blood supply, then the brain cells will die, and it may be a clot in the part of your brain that helps with your breathing or other levels of consciousness or that kind of thing. So the clot type of stroke for sure, and then also the bleeding type of stroke, those can definitely be fatal because they're bleeding inside the brain, and sometimes folks don't get to us quick enough so that we can help them.
That is a big deal. My mom had a stroke many years ago, and it was a hemorrhagic stroke. My dad got her to the hospital as soon as he recognized it, and she has no lasting effects at all.
That's great.
She was very, very lucky.
Yes, absolutely. Yep.
So it makes sense that your acronym for the warning signs of stroke is BFAST. What does BFAST stand for?
So BFAST stands for, the B in BFAST stands for loss of balance or coordination. All of these things are typically sudden onset.
Okay.
The second one is E for eyes. we're not talking about pupils necessarily. We're really talking about vision. So sudden loss of vision, blurry vision, no vision, and then fast. So facial drooping, arm or leg weakness, usually on one side of the body, but it can be both. Mm-hmm. S is for speech, any trouble with speech, but also swallowing too, sudden onset of difficulty with swallowing. Mm-hmm. And then the T for time is time to call 911. And the reason why we want folks to call 911 versus driving in is because the EMS providers call us in advance. So our emergency department knows that there's a potential stroke patient coming in and knows the time that they were last seen normal so that we can kind of gear our treatment towards that. And we're waiting for them when they arrive.
Okay. Good point in there. Never, ever drive yourself if you think that you might be experiencing a stroke.
No. We also don't want folks to take an aspirin. Sometimes we hear people say that, because we do that for cardiac disease and chest pain. But anything brain-related or neurological or any of the symptoms I mentioned earlier, we really don't want you to take an aspirin because it could be the bleeding kind of stroke. And if it's the clot type of stroke, we're going to try to give a medication that breaks up that clot, and the aspirin may have some effects to that.
Okay, so if you think you're the one having the stroke, call 911. If you think a loved one is having a stroke, should you still call 911 before
Absolutely.
Taking them in?
Yep.
Okay.
Yep.
And is it better to take them in or to call an ambulance?
Call an ambulance.
Okay, because they can get treatment on the way there?
They can get treatment on the way there, and the EMS providers prepare the patient for us. So they'll put in an IV, they'll get their blood pressure, they get all the information that's needed so that when the patient arrives, we have all the information that we need to make some quick decisions.
Okay. Where can people get more information about stroke, Angela?
Sure. So first of all, one of the best places is the American Stroke Association. They have a wonderful website. It is updated on a regular basis. It has a wealth of information for prevention of stroke and for stroke survivors as well. Stroke is really common, but 80% of strokes are preventable. So there's a lot of information on there. We also have a website as well at northernlighthealth.org. And if they type in stroke, then it gets right to that. So they can also contact me as the stroke program manager. I often, it's not unusual for me to talk with stroke survivors and caregivers as well. And I also have a stroke support group that I run. So they can also contact me, and Tracy can probably send you my email and information too.
Okay. All right.
I'm happy to throw that out there.
It sounds like it all starts with having a healthy lifestyle.
It really does. One thing I want to add is that stroke can happen at any age. We see young patients coming in with stroke symptoms, and certainly elderly folks. Really, it's the span of ages. It doesn't really discriminate at all. Some might say, well, how can a young patient have a stroke? They haven't been smoking very long, or they don't have high blood pressure. But it could be related to a variety of things. It could be that maybe they have high blood pressure and don't know it, and they're on birth control pills, or they smoke and are on birth control pills, or there's a variety of things. But I just want to make sure that people are aware that it can happen at any age. So knowing the symptoms is the biggest part, because if you get to us quickly, then we can help.
Okay. Remember to be fast.
Yes.
Okay. Angela, that's what I had. Did we miss anything? Is there anything you'd like to add?
One of the things that I just want to drive home is, just getting to us quickly. Even if you have these symptoms and they go away, like we call a TIA or transient ischemic attack, we still want folks to come to us quickly. It's still considered a medical emergency, even if the symptoms go away, because we don't know when they're going to come back. And if they do, it may be the big stroke, So we really want to make sure that patients don't go back to bed. They don't go to their eye doctor. They just need to come to the hospital.
Okay. Yeah, better to go in and find out it was nothing than to not go in and then
right.
It's a warning for a bigger stroke.
It really is.
Okay.
Yep.
Absolutely.
And we see these folks quickly. So if they have stroke symptoms and they come in via EMS, we're going to see them quickly.
Okay.
Because it's a medical emergency.
Find more information at stroke.org and at northernlighthealth.org/services/stroke-care. Next, as we head into summer, the Maine Bureau of Highway Safety is encouraging people to check their cars before locking them up, just in case there's a child inside. Here's Erica Davis to talk more about children and heat stroke. What is the heat stroke prevention program?
May 1st, 2023 is the National Heat Stroke Prevention Day. And ultimately, this campaign focuses on the issue of heat stroke leaving children unattended in motor vehicles, and ultimately that all hot car deaths are preventable. So we really want to encourage and urge parents and caregivers to learn about and share critical information regarding the dangers of leaving children alone in hot cars. And the Maine Bureau of Highway Safety encourages all parents and caregivers to never leave children alone in or around vehicles, even with the windows down.
Okay. I know one way this can happen is leaving a child in a car, but there's also the risk of gained access. What is that?
Yes. So more than half, over 58% of these hot car deaths within the U.S. occur by gained access at home. And that's usually while the car is parked in the driveway. So a busy parent or caregiver might unintentionally forget that a quiet or sleeping child is in the back of the vehicle, but the gained access is also when a vehicle is left unlocked and the child has then gained access into the vehicle, and then either there's a child lock and the child is not able to get out of the vehicle. And, if it's a hot day out, that can really lead to a very serious issue, a very serious problem, very fast as well.
Yeah, and parents may say, oh, my child would never go in and play in the car. But I remember as a kid, there were junk cars down behind my grandparents' house. We used to go down in the woods and play in them all the time and pretend to drive and whatever. And they were junk cars. I mean, the door locks didn't even work on those. But but it can be tempting for a kid to get in and say, hey, let's get in and pretend we're driving.
Absolutely. Yeah. And that's why we just really want to make sure that we're, spreading the awareness and the education regarding this and how important of an issue this is, and that we really want to make sure that parents and caregivers understand the risks associated with the gained access or with, forgetting your child in the back of a vehicle or, those types of situations.
I think a lot of people, when they hear about a child that got forgotten in the back of the car, they think, oh, what a terrible parent. But it's really not as difficult as you would think if you have a child that's particularly sitting back too, right, who's being very quiet and you've got something else on your mind and you get out and just don't think about it.
Yeah, that's absolutely correct. Yeah. A lot of people would think that they would never forget their child in the back, but it can happen to anyone. And, if parents or caregivers have busy schedules, lack of sleep, any change in their routine, it can distract us a lot easier than one would think. Obviously, thankfully, Maine is very fortunate to encounter very few of these horrific incidents, but there's still 942 incidents from 1998 that have occurred within the United States. So it's still something that we want to address and provide education on.
So you have the Look Before You Lock campaign, which includes some tips to help parents and caregivers avoid exposing a child to heat stroke in a car. Can you give us some of those tips?
Yeah, absolutely. So in order to prevent this, we would definitely recommend to make it a habit for parents and caregivers to look in the back seat every time that they exit the car. You can also set up a system to check the backseat of your car for your child every time you get out. So this could mean setting your cell phone or purse, gym bag, a briefcase, something that you would need to reach for once you leave your car, putting that in the back seat, and that'll help to make sure that you see the child, once you open the door to get them. We also recommend, never obviously leaving a child in a vehicle unattended ever, even for a short time period. And of course, always locking the car, putting your keys out of reach, and ask your daycare provider to call you within a few minutes if your child is late for daycare. And this is one that's actually very, very important and a great tip and advice for parents and caregivers that might drop their children off at daycare.
That's really true, because if you're distracted and it doesn't occur to you that, oh, I didn't stop by and drop my child off at daycare, you get to work, oh, I must have dropped him off, and you get out and just go. If the daycare calls and says, hey, where's your child? That's a great wake-up call, so that's a great tip.
Absolutely, yeah.
So how about if you're, for instance, in a parking lot and you notice that there is a child in a car unattended, what should you do? How should you react to that?
Yeah, so if you're a bystander and you see a child in a hot vehicle, just make sure that the child is okay and responsive first. If not, call 911 immediately, of course.
Yeah.
If the child, appears to be okay, try to locate the parents if there's two of you. If you're at, a Walmart or something, have the security management call for the car owner over the PA system.
Right.
And then, if the child is not responsive or appears to be in distress, obviously attempt to get them out of the car to assist the child. And that can mean even if you have to break a window. So in many states, and this includes Maine, we have Good Samaritan laws that protect people from lawsuits for getting involved to help a person in an emergency. So just please, if you do see a child in a car and they appear to be under distress, trying to get them out as fast as possible is the best way.
Right. What are the warning signs that a child may be suffering from heat stroke?
Yeah, so the warning signs to look for is red, hot, moist, or dry skin, no sweating, could be either a strong rapid pulse or a slow weak pulse, nausea, confusion. And ultimately, if a child exhibits any of these signs after being in a hot vehicle, you want to quickly spray the child with cool water or with a garden hose. And of course, call your 911 or your local emergency number immediately.
What you should not do, correct, is take your child and drop them into a cold bath or into an ice bath. Is that right?
Yes, that is true. Yep.
Too much of a shock to the system. So Did I read that there's an online course that can educate people about heat stroke prevention?
There is, yes. So if anyone is interested in learning more information about this, parents, caregivers, daycare providers, they can go to carseateducation.org, and there is a couple different general education courses on there, but they have specific ones for heat stroke prevention, and they have English and Spanish languages on there as well for the course. So definitely I recommend any parent or caregiver that's interested in wanting to learn more, definitely check out that website to take that online free course.
Okay. I would add that it's a good thing for grandparents to go in and take a look at, because as a grandparent, you're not used to having that child in the car, and it would be a lot easier to just kind of forget that they're there and I've got to get into this store and do something and forget the child is there. So an important course for grandparents as well.
Yes, absolutely. Great point.
So can people find more information about the Look Before You Lock campaign on the Bureau of Highway Safety Facebook page or website?
Yes. I would recommend, if anyone's interested in the heat stroke prevention campaign, to go to, this is NHTSA, which is NHTSA.gov, and then /campaign/heat stroke. And that is going to be the National Highway Traffic Safety Administration. That is where they can find a lot of great information regarding heat stroke prevention. Of course, you can also go onto the Maine Bureau of Highway Safety website as well to find more information, also more information about our different program areas that we cover, and one being child passenger safety, of course. So definitely, if anyone's interested in learning more, check out those websites.
Get in the habit now and protect your loved ones by remembering to look before you lock. I'm Cindy Campbell. Enjoy the rest of your weekend and stay healthy.
Join us again next weekend for Maine Concerns with your Town Square Media News Team.